Good morning. Thank you for joining me on Your Health Matters. I'm your host, Tracy Trypuc. I will introduce my guest, Dr. William Spencer, in a moment. But first, I'd like to discuss with you the importance of receiving your flu vaccine. Last week, as you can see by the photos and video, like many Americans, I received my flu vaccination. This is important because 5% to 20% of the population gets influenza, and more than 200,000 people are hospitalized from seasonal influenza complications. An annual seasonal flu vaccine, either a flu shot or nasal spray flu vaccine, is the best way to reduce the chances that you will get seasonal flu and spread it to others. When more people get vaccinated, less flu can spread to a community. Who is at risk? The following are populations who are at risk for developing flu-related complications: children less than 5 years of age, but especially under 2, and adults greater than or equal to 65 years of age, as well as pregnant women, American Indians, and Alaskan Natives. It is recommended that all people 6 months of age and older should receive an influenza vaccine each year. Please discuss individual risk factors with your doctor. You may also receive more information about the flu at the links that are provided on the screen. Please join me and talk to your doctor about receiving your flu vaccine. I got my flu vaccine. Did you get yours? And now we move on to a statement by the Suffolk County Executive Steve Bellone and the Health Commissioner James Tamarkin. Both the County Executive and the Health Commissioner encourage residents who smoke to join the American Cancer Society's Great American Smokeout next Thursday, November 20th, by quitting or making a plan to quit smoking. County Executive Bellone says, "We encourage those residents who smoke to make that decision to quit and to increase their chances of succeeding by obtaining the help of a trained advisor. Suffolk County's tobacco cessation program is available to all county residents who wish to live longer, healthier lives." Tobacco use leads to disease and disability, says Dr. Tamarkin. On average, smokers die 13 to 14 years earlier than non-smokers, and for every person who dies from a smoking-related disease, 20 more people suffer, with at least one serious illness from smoking. There are several centers available to assist with smoking cessation programs. The classes are free to Suffolk County residents, though there may be a fee for medication if a participant is medically eligible. Call 631-853-4017 for more information. And now for today's topic: the dangers of powdered caffeine, what parents should know. My guest today will be Dr. William R. Spencer, MD. He's a Long Island otolaryngologist and pediatric airway PC. He is also a Suffolk County Legislator from the 18th District. And I am waiting for him to call in to the show. He is very busy and he is at the hospital this morning. So I will just fill in some time with some information about the powdered caffeine legislation. Just recently, on November 5th, County Executive Bellone signed into law legislation that was co-sponsored by Suffolk County Legislator Presiding Officer Dwayne Gregory, Legislator Spencer, and the Suffolk County Legislature for approving the adoption of legislation banning the sale of powdered caffeine to minors. When I asked Presiding Officer Gregory yesterday, he asked me to share the following. Powdered caffeine is a dangerous health threat to everyone, but especially minors. A single teaspoon of powdered caffeine is the equivalent of 25 cups of coffee. To give you an idea, this is a bag, a 1-pound bag of powdered caffeine. Hope you can see that. Now, The recommended dose of that is 1/16 of a teaspoon. So I went out and purchased a set of spoons, and the smallest spoon that I could obtain was 1/8 of a teaspoon. 1/8. That's the smallest spoon that I could get. I have read and have heard that they do sell special spoons to dispense the 1/16 of a spoon. But a single teaspoon, which is this size, a normal size teaspoon, is equivalent to 25 cups of coffee. Now you'll see on the table here I've got 3, 4, 5 cups. So that's 10 cups. 12. Well, I might not fit. 14, 15. And I'm going to lose my water here. Right up to 18, 19, 22, 3, 24, and 25. I'm going to have to make a little, there we go. 1 teaspoon. 1 teaspoon of powdered caffeine that has been available to children is equivalent to 25 cups of coffee. And the potential for overdose and abuse is a clear and present danger. Again, these are Presiding Officer Legislator Dwayne Gregory's words. We are hopeful that FDA will adopt a similar ban and carefully regulate dosage recommendations, as well as requiring prominent warning labels. As we wait for the federal and state government to act on protecting our children's health, we have done what we can do by prohibiting the sale of powdered caffeine to minors. Caffeine is an addictive chemical, and with the concentrated powder form, we have a higher level of poisoning concern for our children who may use this product as a recreational drug. So unfortunately, while we're waiting for Dr. Spencer to call in, there was a terrible tragedy of an 18-year-old high school wrestler who passed away just prior to his oh, here he is. That's perfect timing. Hello, Dr. Spencer.
Hi, Tracy. I was calling you on from my hard line, but I don't think that's a couple minutes ago. My she probably doesn't recognize the number. I'm calling you from a cell, and I'm worried the call will drop. Can I call you back from the hard line?
Oh, sure. Go ahead. Go ahead. That's fine.
All right, I'm going to call you right back.
Okay. Alrighty. Okay, he's going to call me right back. What I was about to say is, unfortunately, there was a tragic death of an 18-year-old high school wrestler who passed away just prior to his high school graduation. Hello.
Hi.
How are you?
I'm wonderful, thank you. How are you?
I'm good, thank you. Welcome to the show. For our viewers, this is Dr. William Spencer, who's also the legislator for the 18th District here in Suffolk County. And I thank you so much for taking the time to speak with us today.
Thank you, Tracy, for having me. It's always an honor.
Yeah. So anyway, I just read a statement from Presiding Officer Gregory about the bill, And so your timing couldn't be more perfect. I was just explaining to the viewers about the terrible tragedy of Logan Steiner, the 18-year-old high school wrestler who had passed away just prior to his high school graduation. And I was about to express our thoughts and prayers going out to his family. And that the official cause of death was from caffeine overdose. He apparently was using it as a performance-enhancing drug, which led to a cardiac arrhythmia and a seizure. And the FDA does state that teenagers and young adults may be drawn to these products for their perceived benefits, which you and I have seen this before with other products.
Absolutely.
I do have here, just so you're aware, I do have a bag of the powdered caffeine. I do have measuring spoons, although I could not find a 1/16 size, but I also have on the set 25 cups or mugs for coffee, and I showed that 1 teaspoon equals the 25 cups. So
it's mind-boggling to really think that there's something out on the market that is that potent and can cause that much harm.
Right. So I just was going to, basically I just want to let you know quickly what Presiding Officer Gregory said, that it's a dangerous health threat to everyone, especially minors. We are hopeful that the FDA will adopt a similar ban and carefully regulate the dosage recommendations. And as we wait for the federal and state government to act on protecting our children's health, we have done what we can by prohibiting the sale of powdered caffeine to minors. Caffeine is an addictive chemical, and with the concentrated powder form, we have a higher level of poisoning concern for our children who may use this product as a recreational drug. So my first question to you is, after hearing that quote, what was the impetus that led to do you think that led not only to the sponsoring of the legislation, but also the unanimous vote to approve this ban?
Certainly. Well, I think that this is a situation where we see something that is an imminent public threat, and it is something that we can do something about. And I think that the legislators who I feel really want to protect our constituents saw this issue as something that we should take action on immediately. Mm-hmm. And a lot of times there's things that are debatable, but when you look at a substance that powdered caffeine that is this powerful, to just give you some perspective, as a physician, I write literally hundreds of prescriptions a week for substances that are controlled because they're medications. And when I think of these substances, typically if you were to take a teaspoon of them, in the vast majority of cases, they would not be lethal. Mm-hmm. So you have something that are controlled as drugs, that you could take that amount. But on the other hand, we have something that there's just no regulation whatsoever out in the free market that a teaspoon of is lethal. I think that this is just an extremely powerful point, and there's been really a great response. I think that there's a few other ripple effects of this legislation. So it not only starts in Suffolk County, but this week in Dallas, the AMA is taking up this proposal, and they are expected to act to recommend that powdered caffeine be banned. So that's one national effect. Mm-hmm. And then when we see that the company is considering or they're reformulating their product, I think that when they're not doing that because they're nice guys, I think they realize that this really crosses the line.
Right.
And finally, to be able to have Senators Brown and Senators Blumenthal really join with the not-for-profit representing Logan Steiner's family and Legislator Gregory and myself to go down to Washington, D.C. to give testimony in front of the FDA. I really think this is something that strikes close to home. Anytime that we see the loss of such a promising individual at the prime of their life and one of our children, I'm sorry that it's happening too late, but to protect Logan. But I do think that this will save lives.
Mm-hmm. Oh, I agree indeed. I mean, I was reading on one website that they suggest utilizing a micro scale for exact measurements, and that it was even difficult to obtain the 1/16th measuring spoon. However, I also then was reading that as of July, the FDA advised consumers to avoid powdered pure caffeine. However, that was just an advisory. And then poison control officials want the U.S. FDA to restrict the use of caffeine powder, so that's good to hear about the AMA as well. And Senator, Richard Blumenthal, who you just mentioned, says that he would want the U.S. FDA to restrict the use of caffeine powder by issuing a warning. And the senator further stated that it should be taken off the market because it represents an imminent hazard and has no nutritional value. So now, did you just say that you have been asked to go down to Washington to testify?
Yes, I have.
Oh, that's terrific.
To go down,
you're becoming a regular down there.
I have been, and this is important. I'm excited when we're able to see legislation that we do here not only protect people in Suffolk, but really kids across the country. And I think Tracy, with this thing, what is really baffling with powdered caffeine, when you talk about the 16th of a teaspoonful, when you look at most homes, and if you think of, we know gallons and cups and pints, and if we think of the smallest common measurement in a home, it's a teaspoon.
Right. Right.
And so when you consider that, I mean, you may have some measuring spoons there that you can do maybe a half a teaspoonful, but when you think of a 16th of a teaspoonful, well, to have something that you recommend, the recommended amount is less than any common household measurement, that is really troubling. Besides that, when you think of a 16th of a teaspoonful, you're really talking about a digital scale to be able to measure that, as you stated. And a digital scale, usually you're talking about something you would find in a pharmacy. So you can buy this huge bag. It comes in like, a 1 pound bag or a 5 pound bag. And in that bag, you literally have hundreds of teaspoonfuls. You could potentially kill hundreds of people with one bag of the stuff. So that's where you see something like that, and it really baffles the imagination.
Well, and plus the mindset too of adolescents, where a little pinch, is one thing, but maybe a little pinch more might be a little bit better.
Exactly.
And but they don't realize the potency of the product, and which is where I wanted to just ask, can we discuss like some of the symptoms of caffeine overdose and caffeine toxicity quickly, if we could, please?
Oh, certainly. Well, when we speak of caffeine, the draw is that, wow, it is going to enhance performance. And it's not. It's deceptive. It causes the body to bypass its normal controls. So it overrides the need for sleep. It overrides the need for thirst. And that can give the deception because you are on a stimulant. There's no energy. You're on a stimulant that there's increased performance. So that can give, especially a young person, like you said, if a little bit helps, then a little bit more will help more. But really, when you are stimulating the brain, it's kind of like you're just adding fuel to the fire. And so when you're driving a heart so fast with the stimulant, well, one of the things you can do is you can cause it to go off rhythm. So you can have an arrhythmia. And then you have 1 in 100 kids that have baseline cardiac defects. And so whereas an arrhythmia is a threat to anyone, even a healthy heart, but if you have someone that has a baseline cardiac defect, an arrhythmia can be fatal. Secondly, with the caffeine, it can cause sweating, it can cause anxiousness, it can cause confusion, disorientation, and then ultimately that can lead to coma and death. So it's just the effects that you would see if you were using any sort of illicit stimulant on the street, a drug. And it can serve as a gateway to also lead to further drug use. So those are some of the effects as I understand them.
Okay. Are there, is there an education component with this legislation? Or this, actually, I should say law, since it was signed into law. So congratulations.
This particular law really focuses on preventing that product from getting into our retail stores. And we only know of a couple of stores that it's being sold in retail locally.
Yeah.
But one of the educational components that we're still following with the stimulant drink, and I was just overwhelmed that we had over 100 entries from Suffolk County with our stimulant drink educational program.
Oh, that's excellent.
Which really focuses on caffeine. And we're going to do that again. We're gearing up for round 2 of that. So
okay, that's wonderful.
We have to continue the education.
Yes, and I can say that for the purposes of this show, I did try to acquire some of the powdered caffeine, and it has been removed from several shelves in various stores and has become more difficult to get online. So I had to borrow some from somebody else that was using it as a teaching aid. And they honestly, I asked them, I said, is that because, I said, yeah, they were clamping down. So I honestly believe that's because of your efforts here in the county. So I want to thank you for that.
I want to thank you, Tracy, because you have been someone that has helped me tremendously in your role on the Board of Health. You've been a tireless advocate, and I appreciate what you're doing with your show and what you do with your personal efforts, and you've made a big difference for me, and I consider you a co-champion in this effort.
No, well, thank you. Thank you so much. And I want to continue helping you as best I can further as you further go on with your endeavors to help children and the public here. And so basically, to finish up here then, basically the purpose of the law is to prohibit the sale of caffeine to minors, and no person shall sell, offer for sale, give away, or provide free samples to individuals under the age of 18. And violations shall be punishable by a fine of $500 for an initial violation, with a subsequent violation by a fine of $1,000. And there will be a civil penalty assessed by the commissioner.
Absolutely. But more importantly, I think that we've gotten national attention.
Oh, yes.
And I think that the legislation was just kind of something that opened the eyes of the country.
Oh, yes, definitely. As Suffolk County has on many pieces of legislation, especially even with the energy drink legislation. So, and so I will wrap it up by saying this. Once again, Legislator Spencer, you have done the right thing. As I've said to you before in person, in the words of Marion Wright Edelman, If you don't stand up for children, then we don't stand for much. And you exemplify standing up for children, and for that, I thank you.
Your words are extremely kind. You've made my day, and Tracy will continue to fight on because I know there's more work to be done.
Yes, we will. Thank you so much, Legislator William Spencer, for joining me today on Your Health Matters.
Thank you. Have a great day.
You too, thanks. And that concludes my show for today. Again, I would like to thank my guest, Legislator William Spencer, Suffolk County Legislator, and I applaud the work that he and his colleagues are doing on behalf of the children here in Suffolk County on this important public health issue. And I ask that you join me next week for another show of Your Health Matters, when I will have a noted expert join me to discuss Ebola preparedness on Long Island. Thank you, and I wish you a safe and healthy day.